I think a good doctor is someone who is compassionate, who listens to their patients and takes into account the whole person, not just the medical disease or the diagnosis, but really everything, the total person. My dad is a respiratory therapist, and growing up, I would go to the hospital with him a lot. Saw these relationships that he built with his patients, and I was just fascinated by it. And then as I got older, I started asking him more about respiratory therapy, what pulmonology was, and I just became fascinated with anatomy and physiology, and that's sort of what propelled me into medicine. The first thing I do when I meet families in the hospital is sit down so they know that I'm not in a hurry. I have the time to get to know them, to get to know their child, and really talk to them about what's going on. And then I like to ask them to tell me a little bit about their child when he or she is not in the hospital. Ask them to show me videos, pictures, so I really get an idea of who the person is when they're not sick. And that really helps build a connection with the family and gain that sense of trust with them. In the CVICU, we take care of a lot of patients with congenital heart disease. In the pediatric ICU, we see the whole gamut, from birth to adulthood, kids with congenital disorders, kids with genetic or chromosomal abnormalities. We, of course, have our good days and our bad days, and there are obviously a lot of tough cases that we deal with. At the end of the day, what it comes down to is the family and being there for the family who's going through this. It's their child. But there is a lot of joy in those rooms as well. We have art therapists, we have integrative therapists, we have music therapists. Everyone is really working together to try to give that child the best possible experience, even though they're in the hospital. And the word palliative actually comes from the Latin word to cloak. And so that's how we introduce our services is, we are here to kind of cloak you, to support you as your child is hospitalized, as you're going through this journey, inpatient, outpatient, through all these medical visits, lab draws, everything, we're there for you.